Damas, Homs, Alep, Daraa. Every day in one or other of these Syrian towns, violent fighting breaks out between the security forces of Bashar al-Assad's regime and the protesters and the Free Syrian Army made up partly of deserters. The repression ordered by the regime is fierce. Shelling and sniper fire can be heard at every street corner.
When there's a raid, they shoot randomly at everyone. Old people, women, children, any moving person is a target.
In the hospitals, the security forces are imposing a reign of terror.
We tried to find someone who could treat us until 4 in the morning. The other man's injuries were worse than mine. He'd been shot in the hand and buttock. But all the doctors had been arrested for treating the wounded, and they were forced to sign a document saying they would only treat certain cases, the ones the government would allow.
MSF's repeated attempts to obtain authorization to work in Syria have all failed, but it's been able to supply the doctors on site with medical supplies. One team managed to get into Idlib secretly. They operated on as many people as possible and then fled before the army arrived. According to doctors there, being caught treating the wounded is a more serious offense than being caught with a gun.
At first, when the demonstration started, we sent the injured to public hospitals. But then we were told that injured demonstrators were being tortured or left untreated. Doctors who treat the wounded are also being harassed by the security forces. Security is what worries doctors most. It's difficult. The risk of being arrested is considerable. But despite that risk, many doctors are putting their lives in danger in order to abide by their medical oath.
On its program in Amman in Jordan, MSF is treating the wounded who make it over the border and gathering their testimonies. In February 2012, it organized a press conference and released some of these stories. It denounced the use of medicine as a weapon of persecution and called for the neutrality of healthcare facilities to be re-established.